Dr. Fong, do sealants, sealants on children, actually, those dental sealants. Are they really very, very helpful? Should only children and teenagers wear them, or should adults wear them? How long do they last? Are they worth their money? What's the deal about it?
Dental sealants are very effective for children, especially for children who are around 6 years of age, because as the first permanent molars begin to erupt and move up into the mouth, they have a lot of grooves in there, and during that time when a child doesn't have the dexterity to clean them, those grooves can easily become decayed with food or candy or sticky foods that adhere to them. So the purpose of dental sealants are that when we clean out those grooves, we can place a resin that's flowed right into that area, which will help to seal up those grooves and prevent the sticky foods from penetrating into there and then causing decay later on.
Okay. So are you saying that those grooves are so small that they're big enough for dirt and bacteria to go in, but not big enough for the toothbrush to go in and brush it back out again? Is that basically how those grooves work?
Yes, those grooves are very small on the teeth there, but our toothbrush bristles are not small enough to clean it. But as I alluded earlier, the children don't have the dexterity to carefully clean around those areas there. But sticky foods, once they get into those grooves, they're going to stay there. And if the child doesn't brush it or the parent doesn't help them to clean it off, then it's going to slowly combine with other acids, and then that leads to the breakdown and deterioration of the tooth. So the sealants help to prevent that, because then it prevents the opportunity for those sticky foods to fall and drop into those grooves and crevices of the natural tooth.
Got it. And how long do they last usually, those sealants? Like how long are they good? Is there a number we can put to it?
Unfortunately, we can't really put a number to it. They do last for quite a while. The thing is that every child eats different types of foods. They could be very sticky. They could be very hard. There could be a lot of texture to it. And so over time, that can wear away the sealant on the tooth. And so regular visits to the dentist to check that, to see if the integrity of the sealant has been deteriorating, then we can correct that and replace it, and then help to maintain that sealant on top of the tooth, which it enables to protect the tooth overall.
Got it. And what about adults? Any point for them to have sealants, or does the need for them fall away with adult teeth?
I think for adults, when we notice that the grooves are there and we observe over time that food maybe gets stuck into those grooves, then sealants would be very beneficial for them. I don't think there's really an age that we can say they can get it and they can't. It's based upon what the dental professional's observations are, and maybe the habits and lifestyle and eating habits, I should say, of the adult. The combination of those information will help us to determine what the correct course of treatment would be.
All right, got it. So again, regular dental visits, and depending on the situation, we might, the doctor will kind of tell you. A little bit like a doctor on an average 6 months dental visit, but depends on a person's situation. Sometimes faster is needed simply because certain things is happening. Like with everything else, whether you have a garden, sometimes the weed grows faster or slower in the garden. You might not know really why, but depends on what is happening, how your house gets dirty or not. You got to clean it more often or less often, and only observation on a case-by-case will tell. Is that basically what you're saying?
That's true.
Good. Well, all right. So sealants for teenagers, young people are definitely a good thing. Adults, case-by-case basis, some might need it, for some not really need it.
Yes.